Hello, Dr. Chris Beto, Doctor of Physical Therapy here. We're talking today about the ProStretch Z that hopefully you've received. And you may be asking yourself the question, how do I use this device to address my specific issue that I'm experiencing? We want to go over that today. Right now, I want to talk about the individuals that have right-sided low back pain. Typically with right-sided low back pain, the innominate on the right side rotates posteriorly, creating that pain and impinging upon it, and that's why you're experiencing it. We want to do a quick little check to verify that we are going to address this issue correctly. So if you're having right-sided low back pain, the next thing that we want to look at is your leg length. Oftentimes the right-sided low back pain and with that posterior rotation, the right leg is going to get pulled up and it's going to appear a little bit shorter. Looking at the bony prominences right here in the ankle, they're called the malleoli. We're looking to see if one leg is shorter than the other. That kind of confirms what we're going to be addressing. So if that right leg is shorter, this is the video for you to watch to see how you can address your pain using the ProStretch Z. The next position is we're going to lay all the way down. We're going to bring our legs up into 90 degrees. We want to place the pad of the ProStretch Z over the top of the right thigh. We're going to bring our legs up into 90 degrees. We're going to hold on to the bar. Now the goal is to be pushing towards your body with your hip flexors on the right side, the side with your pain. On the left side, you're pushing away, engaging your hip extensor muscles in the opposite direction, creating this co-contraction force that's going to be able to realign that pelvis back into its normal position. We want to hold this for just 5 seconds, doing 80 to 90% max power, not 100%, just 80 to 90, making sure that we breathe through the process. After each 5-second repetition, we're going to bring it back down into a resting position. This position you can be in for as long as you want. Take a break. But after you're done, you can come right back into it. We're going to do it again. Pulling up with the right leg, pushing down with the left for 5 seconds. Back down. We're going to repeat that 4 times. After your 4th repetition of it, we want to make sure that we kind of reset the pelvis. If we do have an effective change in the innominates of the pelvis and it's rotating back into the right position, you might experience a little bit of groin pain. You might even hear a pop. All that's very normal. You may not be experiencing the pain. You may not hear the pop. Don't worry. We're actually addressing those malalignments correctly. But it's always good to reset the pubic symphysis by doing a nice little adductor squeeze. I'm using my fist. He can use his own fist. You can use your own fist at home. You guys can use a pillow, but we want to have a nice little squeeze right there to reset the pubic symphysis. We're going to lift up into a bridging position just for a nice little reset. Come back down. And that's going to be one full round of doing muscle energy technique with your ProStretch Z to address right-sided low back pain. You can do this multiple times. Obviously, if you're feeling muscular fatigue, let's stop, go about your day. But doing this every day for 1 to 2 weeks is really going to rebalance your pelvis, realign it, and help you to reduce that right side of low back pain overall. And for more information, go to medi-dyne.com.